I'm Peggy Gilpin, and I'm on the board of Global Health Partners and a member of the Saving Lives campaign. I've been involved in Cuba solidarity work since the early 1970s and was president of U.S. Cuba Health Exchange, that's USCHE, for decades. I'd like to take a few minutes to talk to you about the current campaign to donate pacemakers to Cuba for patients who have cardiac disease. Cuba currently has a 3-year backlog of patients who need pacemakers, and they have dozens of patients hospitalized, tethered to external pacemakers because they can't provide the other ones. As you can imagine, people don't last that long on a pacemaker waiting list. Everyone in the United States has access to a pacemaker should they need it. Some of you may have a friend or a family member who has a pacemaker, so you understand this in a more personal way. But to be told that you need a pacemaker, but there's a 3-year waiting list, no one should ever be put in that position. The shortage of pacemakers is but one crisis for the Cuban healthcare system that is being decimated and stretched to the limits by the US blockade. Global Health Partners has been working with Cuba's Ministry of Public Health for over 30 years. During that time, we've donated more than $272 million worth of essential medicines and medical supplies. But the current situation is the most critical we've ever seen. The pacemaker campaign is a unique effort and an unprecedented undertaking. We've never attempted anything so demanding and challenging before, and yet so rewarding. It is reminiscent of the very successful syringe campaign we coordinated so that Cuba could vaccinate its entire population with their own homegrown vaccines during the COVID crisis. We sent 6 million syringes at a time when syringes were almost impossible to purchase anywhere. Cuba developed 3 COVID vaccines that are as effective as Pfizer and Moderna, but they didn't have any syringes. Through our efforts, we raised roughly $650,000, and we saved countless lives by helping them to vaccinate the entire population and reopen the country. The current pacemaker campaign addresses an equally critical need that has life and death consequences. Due in a large part to US sanctions, Cuba has been unable to purchase pacemakers in the international market. As a result of Cuba's inclusion on the, quote, list of countries sponsoring terrorism by President Trump, manufacturers are afraid to sell to Cuba. There has been an unprecedented consolidation within the cardiac pacemaker industry, and there are a small number of companies that dominate the global market. 3 of the 5 leading companies are based in the United States. The other 2 are from China and Germany. All of them use US manufactured components, which means that they require a license from the United States to sell to Cuba. It's more trouble than it's worth for these companies. And the result is that none of them are willing to sell directly to Cuba. We launched the pacemaker campaign last year with relatively modest goals. We plan to raise $150,000 to donate roughly 300 pacemakers. We coordinated this effort collaboratively with Medicuba Europa, the leading European solidarity organization providing medical assistance to Cuba. We led this bold campaign, raising funds in the United States, Canada, and in 9 other European countries. Global Health Partners applied for a license permitting us to purchase and donate the pacemakers to Cuba. After months of discussion with pacemaker manufacturers, we reached an agreement with a leading international cardiac company to sell to us. You would think all this trouble would mean they were making a donation, but they're not. They're giving us permission to purchase. The good news is that so far, working with Europe, we've donated 575 pacemakers and more than double our original goal, and all of them have been implanted in Cuban patients already. We plan to fundraise to purchase pacemakers for the next 3 months. This is an expensive proposition, and we need your help. So I'm asking you all to lend a hand and contribute to support this remarkable project. We'll send as many pacemakers as we can fund. As I said earlier, there's a 3-year backlog. Cuba needs roughly 2,000 pacemakers to take care of their current waiting list. So please do whatever you can. Help us by donating, help save lives, and at the same time, you'll be opposing the blockade that's killing just as surely as bullets and bombs.